Keshi Babubai wants to do some changes in his petition against Honorable Joel Ssegirinya. Now, this is one of her not cases where parties are pulling ropes. Now, Babai's lawyers, the petitioner, seeks court to amend their petition, but the respondents are also imploring court to dismiss these amendments which Babai wants to make. And this is a setback, slowing down the main petition to kick off, and this has took almost like 3 weeks now without the main petition kicking off. But well, let's wait for the ruling to see whether the petitioner will be allowed to amend his petition or it will be just brushed off. And this is going to be happening here at High Court's Division before Justice Isaac Mwata at 11 a.m. this morning. But Pan Galaxy FM is already here, and part of the lawyers for the parties are here, known to even these people in the case, they're all known here. But journalists are already here waiting for this case to kick off, and we believe they'll be joining us in a few. Reporting live for Galaxy FM, Nakai Rashida here at High Court Division.
Okay, thank you, Rashida Nakai. We follow up that story as usual in our subsequent bulletins. Now, the hospital authorities in Kawempe National Referral Hospital want the government to expand the maternity ward and neonatal intensive care unit because of an overwhelming number of deliveries. The hospital's administrators also say that up to 70 mothers deliver at the facility on a daily basis, in addition to premature and neonatals being admitted at the hospital. Dr. Nehemiah Katusime, the hospital's executive director, says the big numbers overpower the few health workers working amidst inadequate staff and space. Katusime says that the facility lacks staff quarters and has only 100 health workers instead of the required 476 health workers.
As we talk, we don't have any staff quarters. You can imagine people are staying very far. Ideally, the medical workers should be near the hospitals because they can be called upon any time of the day. So we hope we shall get some land for expansion. This gentleman next up here has offered to sell the land to us. That in the majority of the admissions are premature babies. So it's a big challenge.
According to Katsime, last year the number of mothers they received went down slightly to 21,300 because of majority not accessing care due to the COVID-19 restrictions. He, however, says that to address the challenge of congestion in the hospital, they have had talks with communities and the neighboring facility to give them land and also to respond to their needs. He says that the number of cases of people coming to deliver or mothers coming to deliver is really high, and it's overwhelming the patient, the doctors and nurses and midwives in the hospitals, as he explains.
The previous year we had the 24,400 delivery. This last financial year, because of the COVID pandemic, the number of delivery came down to 21,300. But that is still a very huge number. So the challenge, one of them is the huge numbers of patients, of mothers, against a quarter the staffing level of the hospital. So you can imagine what the health workers are going through, especially the midwives, delivering those huge numbers of mothers when they are very few. So that's I would say the biggest challenge so far. There are other challenges, but that one of human resource, the limited human resource, vis-a-vis the high numbers of mothers is the biggest challenge.
Now, the Uganda Human Rights Commission has urged the government to establish regulation of internet users against posting fake information on social media platforms. The call comes as Uganda prepares to join the rest of the world to commemorate the International Day of Universal Access to Information that will be happening on 28th of September this year under the theme, The Right to Know, Building Back Better and Access to Information. However, Medi Mulumba, the acting chairperson of the Uganda Human Rights Commission, says access to information has also led to an era in which people are easily spreading fake news to the public. Mulumba says that there is need for adequate punishment for media practitioners and other people who disseminate information that is fake to the public. He says that the growing use of online media is increasingly creating space for abuse of human rights, for bullying on social media and cybercrime, among others. In addition, Mulumba wants the government to establish free internet access facilities across all districts in line with building better access to information.
To ensure that individuals use information correctly and responsibly, they need to be aware of the relevant laws in place and punishment for wrong information, including cyberbullying, stalking, false and fake information, and other abuses of the media. Government should roll out free internet in all districts. Right holders should have responsible use of the internet, where they should be truthful and desist from giving misinformation and fake news. Media houses and bloggers should ensure that information they release to the public is authentic and truthful. We've realized on many instances where we have breaking news, which is not actually breaking news, and at the end of the day, it's just misinformation and imaginations of people. Government should put more effort in educating the public in responsible social media use.
The State Minister for National Guidance, Geoffrey Baluku Kabyanga, reiterated and said that the government's commitment to upholding provisions of these national and international laws is on, but has insisted that this should not be enjoyed by violating other rights of people like privacy and security. He also says that while access to information helps in national building, it should be exercised according to the laws of Uganda. Meanwhile, the Uganda People's Defense Forces, UPDF, has revealed that it will disqualify all persons who bribed their way into being recruited as local defense unit personnel, that's the LDU personnel. UPDF spokesperson Flavia Biekwaso says that the force has received information that out of 10,000 LDUs recruited last month, a number of